Hello, Vincent Carroll speaking. This is tutorial number 49, adverse effects. Adverse effects are very unusual in acupuncture, and insurers know that better than most people because the cost for annual insurance for an acupuncturist that's properly qualified and properly registered is probably about 150 to 200 euros a year, whereas if you're a general practitioner, a GP, you're probably paying about 12,500, so that should say it all. Claims against acupuncturists tend to be very, very rare. And one of the reasons for that, of course, is quite apart from the fact that adverse incidences themselves are very rare. There's a very good relationship usually between the practitioner and the client. So in other words, the client recognizes and appreciates what you're doing for them, and you respect the client. So it's a mutually sort of good space to be in between client and practitioner. So because there's a relationship there, it's unusual for things to go badly wrong. However, one area that I would have a particular area of concern for is the area of moxa. Whenever you're applying moxa, always be present with the patient. That's very, very important because moxa can burn very, very fast and very, very unexpectedly. When I'm using a moxa stick, I'll always make certain to keep moving the stick around at all times, particularly if moxa is applied to the peripheral area. Say, for example, the feet. I'd always check to be sure there's good blood supply to the foot. If there's good blood supply, there's probably good sensation. So I would always check the dorsalis pedis pulse. That's the pulse that corresponds to stomach number 42, point stomach number 42. I'd always use light cotton wool against the toes to make sure the patient can feel the touch of it, because if there was a neuropathy there, they would be unable to feel it, and they would be unable to feel pain as well from a moxa burn. So you need to be very, very careful with that. So I always look out for neuropathy on the peripheries, and I needle with great caution. If a person has, of course, sort of a moxa burn simply because they can't feel the burn and they cannot alert you or caution you that you're using the moxa stick too close, they will have very poor healing as well, because the blood supply carrying the white blood cells are going to be compromised going to the foot as well. And particularly if a person is older, particularly if a person has diabetes, it poses a real and particular risk. So moxa, be very, very careful on that. Also be careful about falls and trips. When people get off couches, they may be lightheaded, their foot may have pins and needles or whatever it might be, and they may stumble and fall, or maybe simple clumsiness. But having got off the couch, and if you had needles put in the person, they may put 2 and 2 together and get 5. In other words, they may presume that you in some way or other contributed to their fall. So I'm always careful when somebody's getting off a couch to be beside that person. And equally if somebody's sitting on a chair getting treated, and that's a very common thing to happen. For example, shoulders. It's very hard to treat somebody lying down for a shoulder because a lot of points are to the front and the back simultaneously. So if a person is lying down, you're not going to be able to treat, say for example, sandra number 15 or small intestine number 12, for example, and also treat points to the front of the shoulder as well. That'd be impossible. So therefore, it's important to probably treat a person for a shoulder sitting up. And people who are sitting up can get lightheaded. I mean, some people don't like needles. So be prepared to be able to put the person's head between their legs. Always have water ready as well. And tell the person, you know, that if you get lightheaded, let me know. And sometimes I just take needles out rapidly and let the person take some deep breaths, give them a glass of water and start off all over again. It's no big deal, but you need to keep the patient informed. Let them know you're controlling, that you're in control of the situation, that you've seen all this before. They can have confidence in you. Black eyes and bruises are another thing that people can be concerned about. I mean, some points bruise very easily. Ren 4, for example, pericardium 6, for example. But other points can bruise as well. For example, urinary bladder 1. So tell a person that bruises can happen and that I suppose needles are needles. And I remember one client of mine didn't want urinary bladder 1 done simply because she was going to a wedding next day. So she felt that perhaps she could get a bruise in the eye. And I understand that 100. So work with your patient and understand where they're coming from and what their sensitivities are. That is so important to that. Other things, of course, the big thing that can happen is pneumothorax. So you need to be very, very careful careful about that. With a pneumothorax, there's some points that personally I always avoid putting needles into, such as large intestine 16, such as lung 1, lung 2, and some of the high up thoracic points on the back shoes, which I do needle, of course. But having said that, I slope my needle in at a very gentle angle, greater than 45 degrees, simply because and the outer back shoes are worse than the inner back shoes when it comes to the possibility of getting a pneumothorax. So just be very, very careful there. That's very, very important, pneumothorax. Other things that can happen, people, can get dizzy, and if that happens again, just be prepared to put knees or head between knees, and that probably is all right. Regarding nerves, touching nerves, yes, that can happen all the time. Some places, particularly like pericardium 6, can be a little bit tingly, but it would be extremely, extremely unusual for something significant to happen there. And a gentle perusal of the medical literature turns up nothing of significance. However, people sometimes, if there was a small bruise or bleed, and if it was in proximity to a sensory nerve, yes, I suppose you could have a propagated sensation downwards. I remember one patient who came to me years ago, but she was very conscious of her own health. She was a professional basketball player of all things, and she had a tingle, a small tingle up to 6 weeks to the tip of her fingers, but it disappeared. We spoke regularly about it. I examined her, saw how things went. I showed appropriate concern, and the whole thing fizzled out. If you buy time, if you show appropriate concern at all times, and out of a sense of genuineness, of course, then in that case, the patient will realize you've done your best, you're doing everything you can, and they realize you respect them and you're listening to them, and it's so important to listen to them. Once a year I get a journal through my post box from the Medical Defence Union, I think it is. It's the insurers of general practitioners listing all the adverse reactions and all the sort of money paid out for adverse reactions in general practitioners of both Britain and Ireland. And it's a dismal list to read, but everything has something in common. The common thread through all of them is most of those actions would never have progressed if there was dialogue, if there was respect shown, if people were not evasive, if there was a genuine concern shown by the general practitioner for the patient, and no sense of evasiveness or lack of transparency. Be honest, and that's hugely important when you're dealing with any patient, because they don't have the knowledge you have, and they may misconstrue events. So it's important that you explain exactly what happened. Oh yeah, another thing that can happen is infection. Obviously, you need to be very careful needling into areas like stomach number 35, for example, or indeed gallbladder 30 into the hip, where you're needling deep into a joint, because of course you can transfer infection. So make sure your fingers are very, very well sterilized up at surgical spirit, as well as needles. Always use a guide tube as well. That's very, very important. And tell the patient that you're using surgical spirit all the time. Drum that into them the way they can remember, oh yes, he mentioned surgical spirit. That's very important, because the person can go out and kneel on a rusty nail, and that can be the villain, not the acupuncture needle that you put in. So, explain that you've kept sort of surgical spirit. Keep contemporaneous notes, good notes. That's very, very important. Date them, have them contemporaneous. Don't alter them afterwards. And be happy with what you've written down. That's very, very important as well. In the very, very unlikely case, you'll have to produce your medical notes. And finally, if anybody ever has a problem, lift the phone, talk to a colleague. That's very, very important. Don't feel that you're by yourself. Colleagues, all of us are here to help each other, and value that as something that we have a collegial, I suppose, connection between all of us, and don't hesitate to lift the phone and ring. And I know a number of colleagues have rang me, and I'm always very, very pleased to help. Of course I am, and I'm humble that a person would lift the phone and decide in their I suppose emergency, or in their hour of need, to contact me as a colleague. But contact anybody that you have confidence in as a colleague. That's very, very important. Don't feel that you're alone. Thank you very much.